Now we go to the last session of the day, and that is on chronic diseases. Now in chronic diseases, we have seen secondary psora. After secondary psora, we have in fact Hahnemann has advised about use of antisoric medicines, that is antisoric treatment. So that's a very long chapter. In fact, a number of pages have been given, 30 pages or so to this part. I have tried to summarize this for the purpose of day-to-day homeopathic practice, that is of antisoric remedies. So this is under 7 heads. Antisoric without eruption, allow well chosen antisoric to act, incorrect antisoric disturbs, 3 errors in prescribing, how and when to repeat, then on mishaps during chronic treatment, and other features. We shall take them one by one. Now, single antisoric is not enough unless the original eruption remains. There is unrepressed eruption remains. Unless primary descent skin eruption remains, that is psora, when latent or secondary, then in this condition, single antisoric is not sufficient. And several of them are required. And this is that when psora is in primary stage, when the eruption is there, then sulfur alone is sufficient. This is what we have not been taught. We have been taught that a single remedy is sufficient. Homeopathic single remedy is sufficient. You give a single remedy, if the remedy is correct, then the patient will become alright. Hahnemann had said that, but he had said it earlier, before 4th edition. Subsequently, Hahnemann in chronic disease further emphasized this, and this is a very important lesson. Then allow well chosen antisoric to act. Now for a well chosen antisoric medicine, when it is acting, then moderate complaint may be there, sore throat, diarrhea, pain, slight complaint is there. Do not rush to give a remedy. Do not give a intervening remedy. Such occurrences like these symptoms etc. during weeks and months of treatment are merely homeopathic excitation. Patient is already suffering and symptoms may flare up of some symptom usual to his disease, which is less frequently troublesome than before. We have to see that whether it is of same intensity or less intensity is to be confirmed. If it is milder, then we have to be cautious. It is a sign that the medicine is acting deeply into the very essence of this disease, and this medicine should be allowed to continue and exhaust its action undisturbed without giving the least medicinal substance between its doses. So that means once the action starts, we are not to disturb it. That is number 2. Then after that, we go to incorrect antisoric disturbs. Now this incorrect antisoric disturbs, that tells us that suppose a medicine has been selected, antisoric has been selected, but that antisoric is not correct. If it is wrong, then occurring symptoms are different. What will be the result? That after giving that wrong antisoric, some symptoms will occur. Now these symptoms which occur, they will be different. That is not which were present earlier. Never before or never in this way. Either they never came earlier or they were never in this particular way. Peculiar to this medicine. Symptoms can be of this medicine and not expected in disease. That is what we have been taught. Homeopathic aggravation, medicinal aggravation, and then disease aggravation. That is in philosophy we have been taught. But here we are just directly talking of what Hahnemann had said. So this has been generalized subsequently, not expected in disease. So when trifling, if they are little, then they will pass off themselves. Wait, give some waiting medicine, do not give any medicine, give placebo. If troublesome, then that should not be tolerated. If it is troublesome, it should not be tolerated. That means what is the conclusion? That antisoric was not selected correctly. antidote it or give another antipsoric which is more accurately indicated. Then next condition is homeopathic aggravation. When it appears, when homeopathic aggravation appears, it's a sign of an incipient that is going to come, impending cure. Then usual customary symptoms are aggravated, and on the first day and again on some of the following days, gradually they become less and less and less. So that is homeopathic aggravation. Medicinal aggravation and homeopathic aggravation, then that is to be differentiated by whether it is homeopathic aggravation, then it is correct medicine. If it is medicinal aggravation, then that is incorrect antipsoric has been given. Then next here is that there are three errors of prescribing. Now these three errors of prescribing, Hahnemann wants to tell certain things which we have got a tendency and which we should try to control ourselves and not to commit that mistakes. We shall see these errors. First error is to consider the dose is too small. Everybody wants to give a more powerful remedy. Every patient wants a more powerful remedy, and some of our physicians or ourselves during our earlier days, starting days, you want to use a strong remedy. So if you use low potency, you are a low category doctor. If you use high potency, then you are a high category doctor. And very high potency is given, high fees is to be charged, and then a high failure is to be finally. So that is not correct. In fact, we have to see, and the mistake is that dose is considered as too small. Homeopathic dose is very small. But Hahnemann says it can hardly be given too small. The basic purpose is of making the dose lesser and lesser. He says that you cannot make it too small unless, what is the mistake done? If action is small dose means no result. If no result comes, it is because diet and remaining mode of life of patient obstructs action of the medicine. You have to be cautious. Maybe you have selected a correct remedy, and the patient is not following the proper instructions, is taking a wrong diet, and because of this his mode of life, he is not doing exercise, if he is not following the proper hours of sleep, taking proper rest, whatever is the regimen, diet regimen means lifestyle. If the diet and the lifestyle is not correct, first of all, rule it out. If it is okay, then you concentrate on your medicine. Then incorrectly selected medicine has been given. If the selection is not correct, then the dose will become small. Then it is counteracted more easily. Advantage is that small doses which you give, if wrong is also given, then it can be counteracted more easily and cure is continued without delay. Here Hahnemann is telling the advantage of small dose. I have listed all these points with a more suitable antipsoric. So that means that dose is never small. If you consider dose as small, you are wrong. There are advantages of small dose. The advantages are that they are not causing aggravations, they are not causing side effects. So this is all is a point which is very well known. Then wrong choice of a remedy. Now, wrong choice of a remedy, Hahnemann says that beginners commit this mistake. Satirically, Hahnemann says that many of us remain beginners for whole life. That is, we are always beginners. So that is not an advantageous point, it is a disadvantageous point, because one must learn from his experience. Now, what is the reason? There is inexactness, not exact, not prescribing exactly. That instead of working hard, finding an exact remedy, we are giving inexact medicine. Lack of earnestness, lack of seriousness, the application which is required in finding a remedy, if that is not used. I am in a big hurry, the patient has come, give him something. So this is an attitude which will be very injurious. And love of ease, I want to be more comfortable. So Hahnemann describes that these are the three biggest enemies of a homeopath who wants to be successful. There is inexactness, then lack of earnestness, and love of ease. Then great conscientiousness is needed. Sort of OCPD character is required here. Insofar as your selecting a remedy is concerned in restoration of human life, because why it is done? It is to restore the human life which is endangered by this sickness. So those considerations have got to be there. So first of all, investigate the whole state of the patient and internal cause, which as far as it is remembered by the patient. Find cause of continuation of ailments, not only starting but continuation. Once the disease started, why it did not go away? It did not go away because there has been a maintaining cause, which could be his mode of life, quality as to mind, soul and body, together with his symptoms. So all these factors have to be seen, and in the light of that, your medicine has to be right. So wrong choice of remedy is the next point. Then hastiness prevents full action. If there is a hastiness when antipsoric medicine is serviceable, you have prescribed an antipsoric medicine. It is showing some result for many days. Many days the action is continuing. Then what happens? A small or moderate homeopathic aggravation takes place. Good results, and the analogy he says here, the chronology he says here, that good results first appear in 3 to 4 weeks. The starting of the good results may take time. This is Hahnemann is talking to us in chronic disease when 50 millisiemen potency was not discovered by him. It is in centesimal. So good results first appear in 3 to 4 weeks. Action may last up to 6 weeks. And then during repetition is injurious. This is the main thing. That does not mean that no action is there and then you are waiting. Foolish waiting is wrong. In fact, long waiting is foolish waiting. Without action, you should not wait. But once there is action, there is a little relief. Patient comes and says, "Doctor, I am quite better. But can there not be a medicine which can make me more better?" So he wants two superlatives. One is better and second is more. So give some medicine. So no. That yes, you have to wait because action may last for 6 weeks. Then during relief repetition is injurious. The improvement continues till if diminished old symptoms aggravate. If the symptoms which had diminished they aggravate. Second, time of repetition of doses. So you have to see when to repeat the dose. Antipsoric in chronic disease act for long duration but shorter and quickly in acute disease like belladonna, even for that matter, sulfur, arsenic, etc. If you give in acute disease, then they will act for a short time. That does not mean that sulfur you give in acute disease and wait for long. No. Then allow antipsoric remedies 1 to 2 months. It is written in weeks there. I have summarized it. 1 to 2 months period you should normally give for a properly selected antipsoric medicine to act. And along with time, the second coterminous criterion is that the disease state must perceptibly improve. Improvement also should be visible. If both these things are there, then we have to wait. So these three mistakes, which are common mistakes, we are required to avoid them. Then next thing comes how and when to repeat. First of all, again thing has been written that it is injurious to repeat without examination. The patient you have not re-examined and just on the basis of your earlier examination that this medicine is there, you prescribe the medicine, it is wrong. When selected, well selected remedy made beginning of improvement, you have selected a remedy, say CPR for that matter, or Naxonic, or say for any medicine, antipsoric medicine for that matter, and that has been given, improvement is there, but improvement quickly goes away, and cure does not proceed any further. Now what we have to note here that this type of thing is rare in chronic disease. But in acute disease and acute states of chronic disease, it happens quite often that the action goes away. Then what we have to do, when after say 2 weeks or before 2 weeks, improvement comes to a stop. Secondly, no disturbance of mind takes place, that is no aggravation type of, no new features come, no appearance of new troublesome symptoms come. Then former medicine, the medicine which was prescribed earlier, the CPI was prescribed earlier, CPI is a very long acting protein, Metronidazole was prescribed earlier, if any antipsoric medicine was prescribed earlier, but very soon the action ceases and no new troublesome symptoms appear. That means that the earlier medicine is still perfectly suitable. Give a dose of same medicine in a different potency. Now, why Hahnemann said different? Because he that time experimented about early lower potencies also and higher potencies also. Otherwise, he would have said give a higher potency. Because when say 30th was given, then after that again the second dose of 30th does not act, he saw. So he gave 24 also, and he gave after 30th he had no medicine for that matter. So he gave, when he gave 12, then he gave 6, and afterwards gave 18. So these medicines either increased or decreased potency was prescribed. So that is why different potency has been written. This point has been answered conclusively by Hahnemann in 6th edition because a graded potency method has been evolved. So we are talking about repetition. So repetition, it should be very clear in mind when to repeat. Then this is a very important topic here. This is called mishaps during antipsoric treatment. The patient is taking antipsoric treatment from you, and during that some symptoms develop, like overloading of stomach, eat a lot of food, and a lot of excessive overeating has been done. So remedied, it should be remedied by hunger. Don't take any food. Take a little thin soup instead of meal and a little coffee. So that means that only fasting called langhan. So that particular thing is advisable if it is mild complaint. Then disordered stomach from fat meat, especially from eating pork. That is by fasting and pulsatilla. Remember, specific medicine, one medicine for each condition has been given by Hahnemann here. This is very important, and you will be getting this. You can read it in chronic. You must have read it, I think. Disordered stomach causing regurgitation, acidity, nausea, inclination to vomiting. That is Antipsoric. Then cold in stomach by eating fruit. If by eating cold fruit, sort of citrus fruits or sort of ice cold fruits have been taken, then smelling of arsenic. Here olfaction. Olfaction is a milder form of medication. So olfaction of arsenic. Then troubles from alcohol, naxonica. Then next is disordered stomach with gastric fever, chilliness and cold. So there is fever, there is a chill and there is cold. So this is because of disordered stomach. So all this is from digestion, indigestion. All these 6 features here bryonia has been described. Then next is fright. You know the difference between fear and fright? Sudden fear is fright. So there is a more prominent fear and it comes more quickly, that is suddenly, so that is fright. Now in fright, when medicine can be given at once, especially when it causes timidity, then give opium. Attended later, that means patient had fright, he comes to you little late. Or when vexation means anger, when vexation is added to fright, then aconite. Sadness is caused by fright, that is emotional, sadness is emotional, depression, so that is ignatia. Then overlifting or strains, very simple, 2 remedies, arnica and rustox. We are using it in day to day, and we talk of so much of similimum and symptomatology and this and that. But ultimately, where symptomatology and where specific remedy, is a thing which is to be understood very clearly. Here arnica or rust stocks are time tested remedies. Then contusions, wounds from blunt instruments, arnica. Then weakness from loss of fluids and blood, that is China. Homesickness with redness of cheeks is capsicum. Then vexation causes anger, violence, heat and irritation is the king of those remedies, angry remedies is chamomilla. Then besides vexation, chilliness, coldness of body is bryonia. Then vexation with indignation, mortification, throwing away things in hand is staphysagria. Indignation, suppressed anger with silent mortification is colocin. That is, colocin is the anger is not expressed outside. Unsuccessful love with quiet grief. Unsuccessful love. Very interesting. Next is that unhappy love. There is a difference between unsuccessful love and unhappy love. Unsuccessful love is once. Love does not take place. Unhappy love means living together, fighting with each other, jealousy, etc. This and that. So, hyoscyamus, where the cause is continuous. Then, cold. Various forms of cold have been described. Remember, this is Western European country. So, the cold over there and cold here may be different in quantity. But quality wise, it is going to be same because our apparatus is also like that. Some people say that these symptoms have been given in Western European hemisphere, etc. etc. So they may not be applicable. No, it is not so. Here, severe cold, keeping house. Now, keeping house means outside. Keeping bed means keeping the child, taking care of a child, and then catching cold inside. So either of them, it is naxomica. Then diarrhea results from cold, dalchimara, followed by pains, coffea cruda. Remember, this is for those patients who are taking treatment, antipsoric treatment, chronic disease treatment, and they are suffering from these complaints. So you should not try to give remedies which may antidote the effects. But for those who are coming otherwise, you have got the entire remedy open to you. You can prescribe any remedy for them depending on the symptoms. But here our hands are tied because if we prescribe some other deeper acting medicines, then the action of the antipsoric medicine will be disturbed. See it in this light. Then followed by pains. Cold is followed by pains. Diarrhea results from cold and it is followed by pains is coffea. Then cold followed by fever and heat, aconite. Cold followed by suffocative fits, epicough. Then cold followed by pains, inclination to sleep, that is coffea. Cold with consequent coryza and loss of sense of smell and taste is pulsatilla. So this is everything that has been given in those lines. You may go through it again. Finally, many other features have been described here. I have summarized them. That is, frequent change of medicine is very harmful. Hahnemann has written many lines and paragraphs on this, caution us against that. Then, quick action takes place through olfaction. The action is mild also for that matter. Then, unmedicated milk sugar is IgG, invaluable gift of God. Hahnemann says that milk sugar is this invaluable gift of God because you cannot tell the patient that I am not going to give you anything. You wait by single dose because that patient is not going to wait. And secondly, you cannot give him some medicine because that is going to antidote. So sugar of milk is invaluable gift of God. Then in epidemic or intermediate acute disease during treatment, how homeopathic treatment is to be done, that has been written here. Then latest symptoms go first and the first symptom goes last. That is subsequently summarized as Hering's law of cure, but that is what basically Hahnemann has described with evidences. Instructions for administering antipsoric medicines. Here I have enlisted some points, some important features of antipsoric treatment. Best time for dose is not at bedtime. Hahnemann says. It is in the morning while fasting. First thing in the morning after washing mouth with water, because paste etc. are smelling, that is flavored. So instead wash your mouth with water and then take a dose. Then medicine be this paste etc. I have added. Hahnemann has not written, naturally you can understand. Then medicine be given in numbered papers along with blanks. That means that if you are giving 7 doses, give 1, 2, 3, 4, 5, 6, 7. You know which of them is medicine. And Hahnemann tells to write about the diary. So in the diary, this happened. So when I took this medicine, this happened. So that you can understand the action of that particular medicine. So it should be given in numbered doses. Then for females, certain important things are said. One is that neither shortly before the menses, before the flow, or nor during the flow. Don't give antipsoric for that time. And there are females who have premature, long-lasting, profuse flow. For them, give nux vomica by olfaction on 4th day, followed by antipsoric on subsequently 4th or 6th day. For antipsoric treatment, give this nux vomica, and it is very interestingly written here that very sensitive and nervous females who have got this symptom of heavy bleeding, then uh, smell nux vomica every 3rd day after menses begin. After every 72 hours, that means every 3rd day, olfaction or a dose of nux vomica for that matter, till antipsoric treatment continues for menses, so that this irritability is controlled. Then for pregnancy, no harm in antipsoric treatment, instead necessary, because chronic ailments develop more during pregnancy because internal psora manifests. Return of miscarriage can be prevented by antipsoric. Abortions can be prevented. Psoric sickness of mother can cause improper presentation and unnatural labor, responding to antipsoric treatment before or during pregnancy. So what has been done? Sulabh pregnancy. Medicine has been made by this combination people, that they take the medicine of collopilum and this and that, calcarea pos, etc. They are taken. Collopilum is not an antipsoric. So here any specific medicine prescribed like this to a condition which has got many varieties. If all symptoms are alike, then one medicine can be there. But here all symptoms are not alike. Antipsoric treatment is to be given for that matter. Then other features are hydrocephalus, other defects of child, mother's inability for suckling, sore breast, soreness of nipples, erysipelatous inflammations, abscess of breast, hemorrhage from uterus from during suckling. Then they all respond to antipsoric treatment. Then based on symptoms of morbid state before pregnancy, antipsoric treatment should be given. That is, study the constitution and accordingly give the antipsoric treatment. For sucklings, medicines not given to them through mouth, given to mother or wet nurse. It acts through milk very quickly, mildly and beneficially. So that is about the antipsoric treatment. If there are any questions, you may post them to me for answer.